2024. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how pharmacists and pharmacy students like me can help to improve population health, health equity, and patient care through advocacy and education. My name is Cassie Capezza, and I'm a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor and preceptor, Dr. Bratberg.
I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, the University of Rhode Island, nor Boston Medical Center.
Today we'll be talking about recovery from opioid use disorder. If you or someone you know is experiencing opioid use disorder or misuses opioids, call the Massachusetts Overdose Prevention Helpline at 1-800-972-0590, available to anyone in North America. We're joined today by an incredible guest, Stephen Murray, who I will let Dr. Bratberg introduce.
All right. It's such an honor to have Stephen Murray here. He was just an email address a few years ago, it seems, when we were talking about expanding access to naloxone. And I think Stephen's been a wonderful advocate online and in his role at Boston Medical Center and all the different jobs he's had and talked about on other podcasts, This American Life. And so he's taken time out of his busy schedule to come see us. Just his bio, real quick, is Stephen's has a master's in public health. He's I should have known this. What's an NRP?
It's a nationally registered paramedic.
Nationally registered paramedic. See, I learn something new every day. But he's an overdose researcher at BMC, or Boston Medical Center. He focuses on the role of public safety and public health partnerships. So he's perfect for our podcast here. In post-overdose response teams. He recently retired as a lieutenant at a regional ambulance service in Western Mass, and we'll talk more about that later, and has been a first responder for over a decade. He was featured in a recent episode of the popular show and podcast, This American Life, which I've been an avid listener to for many, many years, and did not know he was on it until I just randomly listened to it building my shed, and I was like, oh my God, I know that guy. And so now here he is on my Zoom. Before all this fame, as I said, we got to co-author a publication with some other famed friends from BMC, and hopefully that helped propel naloxone to be over the counter, and that's the subject for another thing. And of course, we get to see each other every year at my favorite organization, the Association for Multidisciplinary Education and Research in Substance Use and Addiction, or MRSA, and here we are, a couple disciplines. I'm going to let Cassie take it away.
So recovery is something new to me. My previous knowledge was minimal, but I did a bit of research to learn some more about it. To prepare for this episode, I read through some materials regarding recovery from the Substance Abuse and Mental Services Administration, or also known as SAMHSA. I was also quite moved by the This American Life podcast that featured you, Stephen, the episode 809 titled The Call. It was very touching hearing how your personal experience through recovery ties into your career and how you treat others. Could you just tell us a little bit about your recovery journey?
Yeah, and thank you both for having me. I love hanging out on podcasts. It's like definitely fun. It's sort of like when you do radio, it's like give a face for radio. Like I don't have to do my hair or makeup, I just kind of show up. I do have my throat coat, which is a type of tea to help keep my voice, radio ready. And yeah, no, Jeff, that was the first paper I was ever, that was my first publication that I was ever a part of. I now have 3, so really just cranking those out. If podcasts counted, I'd have a lot more, but they don't. So anyway, thanks for having me. I will add one other thing too about This American Life, since you guys both brought it up. What was kind of interesting about it was that because my name and picture is not like featured on the thing, I was kind of like a covert member of the cast. And I had people actually come up to me at a conference I went to not long after it, and they were like telling me about this great podcast that they had heard. And I had to like break it to them, like, that was me. I'm the paramedic. I'm that guy. So that was kind of fun. It's kind of like cool to like, have people hear things and not know that it's you.
And this podcast is gonna be the same thing. It's gonna be exactly the same. They're gonna be like, Cassie? I can't imagine. So
yeah, well, I mean, hopefully my name will be on it somewhere. But yeah, no. So to answer Cassie's question, my journey has been an interesting one. For me, substance use started pretty early, especially with alcohol. I grew up overseas. I was living in Europe, and so the sort of rule was like if you could reach the bar, you could order a drink in Hungary, where I was growing up. So started drinking pretty young. That got out of hand really quickly, and I actually stopped when I was like 16, and which is just interesting to have already stopped drinking at 16. And I went on to be well, at what's called straight edge. So I wasn't drinking at all from like 16 to 19. And when I started again, I was headed back to go to school. I had taken a gap year in between high school and college. I was in a band and we were like touring and trying to make it big as a band. It didn't work out. But I left to go to the University of Miami, down in beautiful Miami, Florida, not Miami University in Ohio. So the palm trees got me. I'm a beach guy. I'm now back to the beach. I live in Plymouth, Massachusetts now, but it was always my goal to get back to the beach, and here I am. So Miami was great. I kind of started off in the sort of normal, what I would call normal, like college experimentation phase. Drinking. There's a lot of weed. Adderall was like pretty big, like especially around the library. You could get a lot of Adderall. Also started to take my turn with like hallucinogens. So I did acid and shrooms, and my roommate was like making DMT. So tried all that stuff. Had some pretty amazing experiences on hallucinogens. And things sort of shifted for me. Like, and I talk about this on This American Life, but I had one of two things was shared on that podcast. So one is that my friend Kelly died falling off of a balcony my freshman year, and that definitely impacted me. It like impacts me to this day. It really kicked off a lifetime of grief for me. Little did I know at that time that like grief would become so central to my life. As just a person who used drugs, and a person in recovery, and as a paramedic, and as an overdose researcher, like I literally, that was like the beginning of a lifetime of grieving, and I've never stopped since that started. It's always been one after another. And not that long after that, another friend of mine was actually killed by her ex-boyfriend. He beat her to death on my birthday, actually. Those two events, like I was living really far away from my family. They were still in Europe, and I didn't have great sort of like emotional coping skills. I'd had a very privileged life, very sort of like normal upbringing. I have two amazing, loving parents. I have an awesome younger sister, very supportive extended family. Had never really experienced anything that was like traumatic. And so I didn't take those events well. I had struggled with sort of like some depression, especially like seasonal depression in high school. I'm definitely feeling that this time of year. I I definitely had like a bit of a like not too intrusive like mental health history. And so losing my friends, put me into this sort of spiral of just, depression. And because substances were already part of my life, they became a really easy crutch and coping skill. And I always like to say, like, the only antidepressant that ever worked for me was Oxy. I was in the sort of pre-game to this podcast. I was telling Jeff and Cassie that I had been in recovery. I was diagnosed with treatment-resistant depression and had tried like 5 different antidepressants. And really, the only one that ever made me not feel depressed was an opiate. And it's not approved for that use, right? But that's the only thing that ever made me not depressed. It didn't make me happy, but I felt nothing, and nothing is always better than feeling terrible. And I'd had some like suicidal ideation as well. And um, sometimes I think that like opiates saved my life because that helped me get through that period of like intense grief and depression where I was like super isolated. The thing about opiates was that they like really dulled my ability to function at the doses that I was taking. And so because Adderall had been around, I was using a lot of Adderall to sort of like combat that. But every once in a while, like either, well, first of all, I would run through the script that I had a doctor who was prescribing me Adderall. I'd run through that in like 2 days. I had a friend that would get it prescribed and I would buy it off of him. I'd run through that in a couple of days. And so sometimes when the
And
street supply, go ahead.
and that you're talking like 30-day supplies
Yeah, like a 30-day supply, I'd be
in a
running.
day.
Yeah, yeah, a couple of days. 24 hours a day binge basically. And I also then started to use meth. And so, those drugs worked the way they worked. They were actually, I'm of the opinion that drug use is very logical. And I think in the US, we have this sort of like dominant mindset that drug use is not logical, like that there's some like illogical premise to people using drugs. And like for me, it very much made sense. I was depressed, so I took Oxy. Oxy made me exhausted, so I did Adderall and meth. And then Adderall and meth made me incredibly anxious. And so what do you do when you're anxious? You take a benzo, right? So I added Klonopin to the mix. So
I mean,
um
what's if I hate to interrupt
yeah,
your
no, no,
story,
go ahead.
but I think what's so interesting here is that this is what we teach in pharmacy school, right? Or in medical school or whatever. It's like you have a problem and then there's a solution. And you're right, is that it's this bipolar, to use a bad term, but like it's this disorder of certain conditions are treated by certain drugs, and then other conditions you're not allowed to use those drugs, even though they might have been legal in the recent past. And that and I think a lot of psychiatric pharmacy is that way, right? Is this polymedication. Then I think the other thing that to draw our listeners into is that you're not just saying, I had a soccer injury, right? And I took Oxy for my sprained whatever, shouldn't have been prescribed. I liked how it made me feel. You had we're going to talk about the dimensions of recovery. Cassie's going to talk about that next. But you had all those things, but yet you still had massive trauma, right? From your friends. You still talked about isolation. You had mental health problems. And it's really hard as a young person, right? This is all in your 20s or as teens to say, hey, doc, I have all these problems. Like, and so it's interesting. I'd like to hear, again, it's this cause and effect, and the drugs had the effect, and you're a person who knows, like people who use drugs know what the drugs do to them. They both good and bad. Like you said, you're bringing yourself up to neutral, I think is another point that I know you educate folks on, is they say like people aren't using drugs to get high. They're just using them to live, right? And then you've got all the other things going on. Um, so I mean, it's the big thing I think that I'm thinking about more in our education is really trauma-informed care and the trauma of stigma in medicine, right? And you'll talk about how your colleagues as EMTs have treated folks. We found an article you wrote a year ago on that. Sort of like they didn't know your history, but you sort of like, how are you going to treat people? I'm fly on the wall here. I find that interesting, but also this idea of, chronic disease is traumatic and being in school is traumatic. And so you're talking about being in school, like all those things are forms and various intensities of trauma. But then having a friend die in a domestic, in an intimate partner violence situation, those are like, did you ever think with your resources and privilege to reach out to somebody, or was it, why do I need to do that when I have these things that I'm already using?
I think it was complicated for multiple reasons. So a huge barrier for me in accessing like more traditional care was like my ego. And like I hate to put it that way, but like um I was too proud to ask for help, and also would have been too embarrassed. So to admit that I was struggling, and this ended up becoming a theme with the substance use as well, but prior to that, like to admit that I was struggling with my mental health again, I didn't want to set off alarm bells. My parents were living far away. I didn't want to stress them out. Um, I talk in the like it's funny we're back on like on camera chat these days. I think I talk about in the podcast like I used to be on Skype and like it would look really cool behind me, but like my life was chaos on this side. It actually still is, honestly. Like my daughter spends Monday, Wednesday, Friday in here with me while I work. And so it's a little bit of a different kind of chaos because a 2-year-old is playing in here, but it is still chaos. It looks really good this way, but it's chaos that way, right? So we always like have our sort of uh our ways of putting up shields to protect ourselves, to protect the people we care about. Like, I don't want you guys to have to see my messy office. You can look at my nice background, right? Like, so admitting that like that was that there was like a problem and I wasn't dealing with that well. Like, I didn't even want to admit to my friends because my friends were really upset. And like they looked to me like you're the strong older brother figure. Like that was the role I fell in and that I played. And so while my friends were crying and grieving, I was like there, you know, feel better, like let's feel better, like, you know, trying to make people feel better when I really should have been crying with them. And like I didn't cry in front of anybody uh from like when I was a child until I was in rehab. Rehab was the first time I ever like, well, maybe when my parents did their little intervention. I don't know if I cried that day. I don't remember, but I know I cried in rehab a lot in front
But
of,
you knew that you said in the podcast you knew that the intervention was coming, and I think that was that
yeah,
first. And
that
I
was
think you
relief. Yeah.
and you only were in rehab once, I think. Is that
Yeah,
like
one time. Yeah. So, um, what's interesting is that for me, I never wanted to ask for help. I never wanted to like out myself. But when help was offered, it was like, okay, well, my big anxiety of you guys finding out how messed up this is, that's gone now. You know the cat's out of the bag. And I was like, yeah, like let's do it. You know, I was ready. Um, and like for me, I knew like for me, it's interesting when I went to rehab, and I think part of it was like the time period was like 2011. Opiates were really like the narrative. Like I always assumed I went to rehab because of opiates, but actually it was the stimulant use, I think, that drove me to the place where other people noticed there was a problem. I could have continued using opiates for many, many years the way I was using them because I would use them, I would go through withdrawal, I would take a break, try to build my like lose my tolerance again because it gets expensive, you know, when your tolerance is up. And this was not in like, you know, I was buying at this time you could get an 80 milligram oxy for $8
oh, instead of a dollar
instead of
per gram,
80.
which it became, yeah,
Yeah, yeah. So
dollar per milligram, yeah.
it was cheap back then. Like my dealer had multiple prescriptions and was being prescribed like 2,000 pills a month or something like that. 2,080s a month. And like I was buying, you know, like 400 of them or something, you know. So um I think that my stimulant use is what brought my substance use into the light for other people. But the problem was because I self-identified as someone who had an issue with opiates, like I don't even remember talking about Adderall or meth use in rehab because all the other guys my age there were there for opiates. The guys, I was in my early 20s. The guys in their 30s and 40s were there for coke mostly. And then the guys over 50 were there for alcohol. And so I fell into the opiate group. I was someone that used opiates and used them in a what I would consider to be like a disordered way. But the problem was the communication that came back to my family around what should we expect was really inaccurate. Because stimulant use, the way I was using stimulants, where I wasn't sleeping for a week, and I like we know that that type of recovery takes like 18 months minimum to right yourself to where you're not just sleeping all the time. And like my parents were under the impression that I was going to like get out of rehab and bounce back. And I did not.
Well, which is why recovery is a different journey. And I think, again, we'll have a future podcast on this, but what's so interesting about these multiple substances you're using is you talked about using hallucinogens, which now are on the cusp of being approved to treat depression and those things. There's no therapies that really work for stimulant use, and that's the growing concern, right? It's the so-called fourth wave, both prescribed and illicit, so cocaine and methamphetamine, and if you can get them prescription, which are probably not what they are if you buy them off the street. Um, so that yeah, that's a really interesting narrative. I think the thing that sticks out to me is you talked about being ready, right? And it's this idea of you had these supports, you talked about being ready, you talked about once your anxiety is gone, once people know about it, you are ready to do that. Like, how did you when you're in rehab, were there people there who were forced to be there, or is this a voluntary thing, or like the court case people were there? It sounds like it's a really interesting spectrum you described.
It was a combination. There were some people who wanted to be there. There were some people who were there. They're on their like 11th try. There were some people whose families were making them be there. There was one court-ordered guy that was there. He was like a firefighter that had like gotten arrested, I think, for like OUI. There was one person that was mandated by his job to be there. He was an investment banker. He and I actually became very good friends, and he died a couple of years after we were, well, actually about a year after we were in rehab together. But his job had told him he had to be there or he's going to lose his job because they knew, I mean, New York City investment banker folks are pretty big on stimulant use, but I guess he got to the point where it was like, you need to go. And so they were supportive of him. He was making big bucks. He had a sweet apartment in New York. Like yeah, he was a great guy. But yeah, no, it's like I don't know if I was ready to like be sober or whatever. For me, it was actually the anxiety that I was having. Like I was having all day chest pain that radiated down my arm from the stimulant use. And to the point where I actually went to the hospital one time thinking I was having a heart attack. I basically thought I was having a heart attack all day, every day for like a year. I was at the point where like there was nothing enjoyable about what I was doing. I was just like trying to like keep balls in the air. I was failing out of college. I was a city council. I've been elected to the village council in Coconut Grove. I was having a hard time keeping that together. Like I was doing drugs in the city hall parking lot before being interviewed by the news. Like, so I was like, and I was really, really anxious about criminalization because I was really outspoken about some of the corruption within our area. And let me tell you, as one of the people who's like doing drugs, like I was like one of the least corrupt people, like that was the irony, is like I wasn't the one taking the bags of money in the trunk. And so I was worried, and I had also spoken out against the police. And so I was like really worried that I was like on the cusp of arrest. And in Florida at the time, like possession of just one pill, narcotic pill that wasn't prescribed to you was like, a felony. So sometimes I'd have 280 milligram oxys in my car. Like, what would that even look like? I got pulled over once with that much in the car. And like, luckily I'm white and like I had a University of Miami sticker and I talked my way out of it. But I was under the influence. I was speeding on the highway and I got pulled over and the cop was like, "Hey, you need to slow down." I was like, "Oh, sorry, must have zoned out, like been studying for exams." I don't know what the hell I said. Whatever I said worked. And he was like, "All right, well, just slow down. Have a good night." And like I literally had probably like a 20+ year mandatory minimum sentence in my trunk. Yeah, like there were really serious potential consequences that I was dodging regularly, and I was really, really aware of that. So being given the option to like, okay, let's go get, and I thought that treatment was going to fix me, which it didn't. Treatment brought its own series of trauma with it, and a new wave of grief, as my friends just died one after another, from who I went to treatment with, and also like the trauma for me of being in 12 step and not being someone who's religious and being told that like I couldn't actually get better because I wouldn't accept a higher power because I don't believe in higher powers. I don't think that's a thing. I couldn't reconcile. And so I was being told that I was never going to get better. So like I'm being told all these, like, so there's all this sort of new trauma that came with treatment. So
Which again, sorry to interrupt, but
yeah,
our listeners should know, like, this is not only the standard 10 years ago, it's probably still the dominant narrative today. You must do this or else you're not going to get better, which is sort of anathema to how we do healthcare in any other way, right?
yeah, and keep in mind, this was at a premier rehab facility that was billed as like the best dual diagnosis for mental health and substance use in the Northeast, and A-list celebrities were there. Like this was like the premier level of treatment. And I was like, oh man, if this is the best you can get, like we are screwed. What's interesting is I think that my outpatient program is probably what turned me around a bit because it was more evidence-based and focused on that sort of thing. So I went to the Center for Motivation and Change in New York City, which ironically my sister now works for. She runs their foundation for families. And we just did a podcast together actually about our sibling relationship. And it came out really good. You should take a listen. But
What's that on? We promote all things here. What's
It's CMC Foundation. I think it's CMCF.
we'll put a link in that.
Yeah, you can put a link. But yeah, it's a very raw discussion between my sister and I. It's actually kind of like therapy. It was fun. But yeah, I mean, I think that was where I got some better messaging, and like I was allowed to leave AA. By them, they like told me it was okay, and then my parents then were like, oh, okay, they're saying it's okay, you know. So I started to improve then, but it's hard to talk about recovery without talking about the
treatment, all these other things. Yeah,
yeah.
I think I know Cassie has some things to say, and then we'll move in sort of, I think, the next chapter here.
Yeah, so when I was doing my research and I saw that SAMHSA has a definition of recovery, and it's a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And they also have a recovery support strategic initiative, which has 4 dimensions to support a life in recovery, which includes health, home, purpose, and community. So I was wondering if you agree with this definition, or would your definition of recovery differ at all?
So I think as far as recovery definitions go, this one is really good. It's good because it's actually a little bit vague. And I think that one of the hard parts about the treatment industry is that it's very prescriptive, but in like stigmatizing weird ways. And like I think that what SAMHSA did here was they actually they actually broadened it enough to be less like this is the one path you have to take to get better. And like it acknowledges that, at least it acknowledges from like a treatment standpoint, that like there's a lot of different modalities or ways people can achieve what they're looking to achieve. I do think that a lot of the language we use still is really ingrained in abstinence culture. And so, like, one of the things that I struggle with is that the sort of interpretation of whether your substance use is disordered or not is often left to other people to interpret. And there's this issue of autonomy where, like, the person who is experiencing it has very little, like, you may think that I'm dysfunctional because I'm using drugs and whatever. But like I have a family member who has used drugs as long as I like we used to use at the same time, and they continue to use longer into their adulthood, even recently. And like when you look at our lives, you know, this person is a parent, has a job, you know, maintains the house, you know, has a significant other, is part sort of on this like, you know, health, home, purpose, and community like you just laid out, right? Kind of hits all of them. Still uses substances occasionally that were what was like why they went to treatment so many times, like a dozen times. And like as a society, you would look at the two of us and say, like, oh, Steven he is a perfect example of successful recovery because you think or believe that I'm abstinent. But then you look at this person and it would be like they're looked at differently because they still use substances. And like they would still be described as someone who probably like should go to treatment for that, right? And like, yeah, I think that like we through prohibition, through what we've seen over the last 100 years of over 100 years here in the US of like anti-drug policy and narrative, it's really hard to break those things apart without changing how we talk about drugs in the first place. So like dare education, right? So like don't do drugs, right? Don't do drugs is the prevention side of abstinence-based recovery. And substance use is looked at as being I mean, you guys can't see my hands, but in the middle of this book is substance use. And so we always say, like, oh, we want to destigmatize substance use disorders or destigmatize recovery. It already is, because recovery is part of the book of the good aspects. It's like it's just as good as not doing drugs. Being in recovery is not doing drugs, so it's good, right? We have to destigmatize drugs and drug use itself in order to actually improve the lives of people who are using drugs. So a lot of this work is done around like, oh, let's destigmatize recovery. But like prohibition in and of itself has already done that. In a lot of ways, because if you are abstinent, you are held that like America loves a comeback story. We're all about it. And like as someone who has been identified as someone in recovery, it would be really easy for me to go out there and be like a recovery speaker and like that be my whole gig. And like people, I would like go to high schools and like talk about how I turned my life around without drugs. And like people would eat that up and they would pay me a lot of money to do that because we love a comeback story. But that's not who I am. I don't want to talk about that. I want to talk about how do we change our whole narrative around drugs to make it so that like when I was using, because like Jeff, as you had pointed out, like I should have been able to be like, hey, I'm using drugs, but I'm also dealing with this right now, and I want to work on this. And like have that be okay. And like have it been like I should have been able to go to a therapist and openly talk about my drug use without the therapist being like, a lot of therapists like don't even want to work with you if you're actively using, or like you can't go into treatment unless you're already abstinent when you walk through the door.
Or you're forced to like not smoke cigarettes,
Right.
not use cannabis in a place where it's legal to you for adult use. Like there's yeah, I really love this conversation. And something I discovered actually through my work in Immersa was talking with some of the executive board about, wait a second, so recovery is this, let's just keep going with this, right? Health, home, purpose, and community. I'm like, you know how many people in America don't have those things? Whether they're abstinent, whether they're using drugs, whether they want to use drugs, or they like, and I know you're part of the same group here, and I'm sure Cassie would agree, is like, we need to fix health and we need to have housing first. And if you can give people housing, then maybe they'll have, and we deal with this in the Northeast very extensively, right? And then it's purpose and then community. And people like there's this phrase of, what addiction is the opposite of connection or something. And I'm kind of, or it's not, what is the
Yeah.
TED Talk, right?
Yeah.
And I always say to my class, I go, there's community everywhere. I go, like, again, when you and I were in high school, there was the smokers group, right? The smokers corner. And we called the smokers corner because it wasn't just one person alone and isolated smoking. It was their group of folks smoking, right? And again, they were smoking cigarettes, which they were not 18 at the time. You have to be 21 now. So it's this interesting thing. I'm like, if you're, no matter what you're doing, you have community. But if you've been so traumatized, I think that's the big theme you're talking about here is you were a city council person, you were successfully, you were in school, maybe not doing well, like you had supportive parents, which only just added to anxiety, and which I think a lot of professionals, and I think Cassie would agree, students, is like this imposter syndrome of like, what am I doing? All of these things. Why does someone believe in me? And the problem that I completely agree, and I've written about this, is that the problem with criminalizing things is that universally everybody hates criminals, right? So it's, I guess my question is connecting that sort of dare message to like, you don't use drugs, but by the way, we're not going to give you housing, right? Too bad. We can't help that it's $2,000 for a studio apartment anywhere near where you can walk to in most major cities, right? Oh, and by the way, thankfully, right, it's $15 an hour minimum wage in some states. We've got to think about these foundational levels. Like you use the term coping, and I know you and I know folks who use drugs who are like, I use drugs because it's fun.
Yeah. That's how I
I mean,
started.
it was just New Year's Eve. I'm guessing there were lots of people using drugs that are very dangerous but legal and are therefore safer, but because they're glorified, I'm talking about alcohol here, then it's okay. And they're glorified in all those things you talked about you talk about waking up with a headache. What's alcohol withdrawal, right? Headache and fatigue, all those other things. But we glorify that. We glorify the use, the overuse, and the withdrawal. And I think nowhere do we do that with any other health condition or any other substance use thing. And so I really like how you've sort of painted this spectrum. So, like, what do you think about those parallels to sort of the prevention message where you keep going on that, like the prevention message and the recovery messages? What if we did some of those? I want so like, oh, you made it to recovery. I'm like, well, if we provided all those things first, maybe you wouldn't have used drugs or used them in, like you said, in a non-disordered way. What do you agree with that?
Well, I mean, I think you bring up a really important point on this, like the isolation aspect, and then also these pillars that they've brought up, right? So isolation is interesting. So because drugs, generally speaking, thanks to sort of prohibition narratives, like drugs, some drugs are worse than other drugs. And what's interesting is that um, when we talk about health, opiates are safer than NSAIDs, and you guys are pharmacists. Like, you should know, like opiates generally have less consequence, long-term side effects than taking NSAIDs, right? If you can keep your bowels moving on opiates, like there's very little other sort of like you if, yes, like you'll develop dependence, but like I'm dependent on my lisinopril right now for my blood pressure. I'm dependent on, propranolol when I'm anxious so I don't get sweaty. Like these are like I'm right now I'm dependent on Wegovy. I'm trying to lose weight. If I stop taking that, my appetite would come back with a force, right? So dependency in and of itself is kind of a silly way of looking at it, right? But because heroin, or opiates or coke or meth are so bad, the way they're looked at is so bad, right? It actually forces this isolation, right? So when I was using, I started off my story by telling you about all the different drugs I was doing, right? And you may know tons of people who do those things: alcohol, weed, coke, acid, shrooms, etc. A lot of people do that stuff. Ecstasy, like that stuff is like really, it's used socially by folks. And what I noticed is that as I moved into opiates and meth, the social group got smaller and smaller because people were like, I do drugs, but I don't do those drugs. And so you have this forced erosion of community. And without community, you have isolation. And now, due to our drug supply, isolation means solitary drug use, which means fatal overdose. So because people can't openly, if we could all sit here, if we people who use substances in community are much less likely to die from fatal overdose. Just like if the three of us were binge drinking together and, Jeff had a couple too many, tripped over the couch and smashed his head on the table, one of us would be like, oh man, Jeff needs an ambulance. And like we would call him an ambulance and you're like, oh, turns out like Jeff's got a brain bleed and needs surgery. And like we're gonna like, but because we were in community, we were together, there was safety, there was built-in safety. If you were drinking like that alone, which some people do end up, as their substance use sort of like progresses to that point where nobody wants to be around them, if you had fallen and whacked your head as a paramedic, I'd be showing up when your family member couldn't get in touch with you in 2 weeks, and I'm pronouncing you, from the doorway, like because you've been dead for so long. Like that's reality, right? So you have this erosion of community. The second thing is that because I can't talk about my drug use to my doctors or to my therapist or to my family, or I I'm gonna have the other one that was the dentist, like to the dentist. I couldn't the dentist. I have a dentist story. I hadn't seen a dentist in a couple of years when I was using, and I was in college, and I couldn't find a dentist and whatever. I finally went while I was actively using, and I told them I haven't been in a while, blah blah blah, and they must have known that I was messed up. And like the dentist tells me I have 17 cavities. I keep in mind I'd never had a cavity in my life. I got the sealant. I had good dental care as a kid. Whatever. Never had a cavity. Tells me I have 17. I'm like, oh, they're like, yeah, we're gonna have to do a lot of fillings on you. And I was like, and I'm on my parents' insurance, which was quite good. So I like call my mom and I'm like, hey, they told me I said, she's like, there's no way. You need to get a second opinion. So I go to the next dentist and then they tell me I have 9. And I'm like, okay, well, 9's still a lot, but 17 also, those are a big difference. It's a difference of half, right? So what do? I'm like, screw dentists. I can't trust them. I can't trust them with my health because they just want to do stuff to me. So what did I do? I didn't go to a dentist after that for like 5 years because I was so anti-dentist. I finally, when I met my wife, she was like, "You got to go to the dentist." And in my teeth, I was like a teeth brusher. They stayed, they weren't like in bad shape. I didn't lose any teeth. I go to the dentist and they're like, "You need a deep cleaning." I was like, "I definitely need a deep cleaning. It's been many years." They do like the deep cleaning, whatever. And the dentist comes in and looks at my mouth And this is like, by the way, I'm now in recovery. I'm there with my, girlfriend. Like, I'm like a guy with a, at that time, I'm an EMT, like I had one cavity, one, 5 years of no dental care.
And this is the trauma. This is the medical trauma and all those other
Right.
things. Yeah.
Okay. So now I've sacrificed my health, right? I'm using drugs. I can't access health. If you experience an overdose and the ambulance shows up and you're a renter and somehow it gets out that the reason they're there is because you overdosed, now you're going to lose your housing. So now you've lost home. If your boss finds out that you're using drugs, even if you're the best employee they've ever had, and like, you're using like meth, so you're just like on your game and just like boom, 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 doing everything, they find out you're on drugs. If you're lucky, they'll make you or ask you to go to rehab or whatever. In a lot of places, they'll just fire you. So now you've lost your purpose. Also, if you're a parent and you're using drugs, even if you're the best parent in the world, you can lose your kids, especially as a woman. Mothers lose their kids just for using drugs. So now you've lost your purpose. And because you've been isolated from your drug use, you've also lost your community. So if the consequences of drug use are the loss of those things, and actually the drug use itself didn't cause you to lose all those things, it was the societal view. So like the drug use didn't change your ability to work necessarily, but it changed your ability to have a job. You can't work at Home Depot, for example, if you use drugs. They drug test everybody there. Home Depot, the place where they don't know where anything is already, right? You can't use drugs and work there.
Well, and you can't, and again, to be very clear, you can't use certain drugs
Right. You can't use certain drugs.
that are connected to criminalization. And then you also have all of these situations, no one has any recourse.
Right. Because you've committed a crime.
Yeah, or you may commit a crime. You're
Or you may
considered a liability in
or you
all
might steal the cash.
because you might be, yeah. So it's interesting. You didn't just steal the cash and be like, you can't steal cash, you fired. You're like,
You
I
didn't
don't.
steal it, but you're a drug user, and people think drug users steal
Yeah.
cash. I never
So
stole cash
imagine
from
the
anybody.
anxiety of being a. So it's so I think Cassie's got this next question, but I'll try to lead in here. But the idea is recovery seems both really desirable, but it also seems so far away because you're either losing these things one by one and probably in a rapid sequence, right? You can't pay for your apartment, like all those other things, whether it's an event or not, or you're anxious. Again, you're living in this state of like, this may, like you were just describing, like this may happen. What if they find these pills? Like, all the consequences. People are like, I think people look at drug users are like, they don't know what they're doing. I'm like, they know exactly what they're doing. They know the consequences of their action. And, opioid use disorder defined as use without consequence, but it's not without knowing consequence. It's knowing the consequence, I think, is the subtle difference. So I'll let Cassie ask the next question here.
Please stay tuned for part 2 being released Thursday, January 18th of Dr. Bratberg and I conversing with Stephen Murray. In the next part, we'll hear more of his personal experiences, including his support system through his recovery and how he advises other healthcare professionals to provide the best care for individuals in recovery.
We post all our episodes at PharmD Pub Health. That's Pharm like pharmacist, PHARMD as in doctor, Pub Health. On Instagram, connect with us on LinkedIn. Turn on post notifications so you never miss an episode. Smash that subscribe button now for The Regimen on anywhere you get podcasts, Spotify, Apple Podcasts, YouTube, Amazon Music, anywhere you listen, and follow us on social media for any of those updates. Thank you so much, Stephen. It's been wonderful, and I'm sure we'll be in touch again.